If you don't have, I'll just WhatsApp this file to your group leader. She can share with all of you. Okay. So I think you have all this file already. Anyways,
Doctor, we don't have it. Just 1 minute. We're going to get the teacher to send it to us.
Yes. If you don't have, I'm right now sending it to your leader so that she can share it with all. So here is the file I'm sharing. So I have sent it to the leader on girls and now for the boys also. For the boys leader, I'm sending it. So I have shared it with both the leaders. Right now, what you see, what I'm sharing on the screen?
Yes, doctor, we can see.
You are able to see what? Which window? Because I see something else.
The tendon hammer and...
Okay, right. Yes. So that is the screen you are seeing. So because I have multiple windows open and the one which you are able to see is the file proper, right?
Yes, okay.
Good. So let me go to the file now. Okay. So basically this was supposed to be a clinical examination, and since this semester there were a lot of changes which occurred, so this confusion resulted in this topic being included exclusively in OSPE now, I believe, as I understand from you. Earlier we discussed about OSCE also about this. Have you covered this part in your OSCE?
We covered the first instrument,
the tuning fork.
Yeah.
In the OSCE, you have covered this? OSCE session was done for neurological examination?
Yes, we only done the tuning fork for the vibration test examination.
Okay. Okay, so you discussed with about the tuning fork. Actually, clinical examination doesn't include the priority is not about the instrument. Actually, it is the steps taken to identify the whether the person is normal or having some abnormality, and second, what is the site of abnormality, isn't it? That is the real purpose of clinical examination for any system. Okay, so it has to be followed by certain steps, an inspection, palpation, and all those things. So for CNS, we also follow similar thing, but we use some instrument which will help us. So these are the two very instrument which you see on the screen, the tuning fork and the hammer. This is called as reflex hammer. What is this instrument called as?
The tendon hammer.
Okay, here it is written tendon hammer. Okay, you can call tendon hammer, but the proper word, if you see on the hospital side, it is reflex hammer. Okay. The point is, the word hammer should be there. You should know that it is a hammer, isn't it? We already know this. But since it is not our language, I just want you to remind, because clinically this is one of the most important tool you should remember also for your exam. Okay. So remember this. This is a clinical hammer, reflex hammer, or as mentioned in this slide, you can call tendon hammer. Okay. Clear? And what is the function? Why we use this?
For reflex examination?
Reflex examination. Now, please, anything I ask during the discussion is very, very important for you, okay? So if you know the answer, tell it. If you don't know, remember once we discuss the answer, okay? So as you said, the instrument shown in this picture is a reflex hammer or clinical hammer or tendon hammer. So any word you remember, and you should know the name proper, okay? I recommend you to use the word reflex hammer because that is how it is known, okay? Second thing, you have to remember its function. Where it is used, as just now you told me, it is used to elicit reflexes. Now reflexes are many types. So what will be your proper answer?
Like jerk reflexes.
Sorry, I could not hear you.
Jerk reflexes, like knee jerk.
Yes, exactly. You can say the answer jerk reflexes. Okay. Or the proper word is stretch reflexes. Okay. So you can remember that as the major function. And if you are asked, can you give me some examples of stretch reflex? Then you should know knee jerk, ankle jerk, bicep jerk, tricep jerk, isn't it? This is easy. You already know this, isn't it? So remember this. So this is a very, very important instrument, and I want you to remember this. Okay. So this is a hammer, clinical hammer, reflex hammer, tendon hammer. It is used to elicit stretch reflex or jerks. Examples of some very popular stretch reflexes or jerks are knee jerk, ankle jerk, bicep jerk, tricep jerk. Okay. Let us go ahead. Now here in the clinical examination of the nervous system, we do two major things. Actually, not two. There are more than two, but usually we study only sensory and motor system. So we have sensory system examination and motor system examination. After that, we have examination related to posture and balance, so that we can evaluate cerebellum also. Okay. So here is our motor system examination. In observation, we will see any abnormal movements. Okay, these include twitches, tremors, different types of tremors and everything, and any other abnormality related to muscle contraction. Okay. Also in the observation part, we will see atrophy or hypertrophy, whatever is there in the muscle. So that will also be seen here. When you palpate, you are looking only for tenderness. By palpation, we don't have a lot of thing to do in the muscle. So you look for that. In general, remember for motor system, we go from peripheral part to the central part. So we start from fingers. Suppose we are doing motor system examination of upper limb. You start from fingers and then go towards the shoulder. Okay. So from periphery towards the center. That is how you will look for tremors and everything. Okay. Is there anybody who is in the room and not getting access? Okay. I think so. So next thing is,
Doctor, how are we gonna have a question as and this? Can you give us just an example?
in the end, I'll tell you the question and answer session. Okay. I'll tell you how it is done. Okay.
Okay, thank you.
Okay. Right now, focus on things which I am repeating. They are related to your exams. Okay. Okay, just now somebody is asking for admission. I have given. Okay. So as I said, focus on things which I am repeating. They are related directly with our OSPE exam. Okay. So what I was discussing, observation. In tone, when you are looking for tone, you ask the person to relax his arm or leg, whichever part you are discussing, and you just passively move the joint. So maybe elbow joint or wrist joint, you just passively move it and see how much resistance you are getting. You tell the patient that don't contract and then you see. So normally there should not be too much of resistance. It should be less. Okay. And it is less than normal, then it will be hypotonia, and more than normal, it will be hypertonia. What is less than normal and what is more than normal? With clinical practice, you will know. There is no specific counting for that, no specific measurement for that. Okay. This is what you will know with clinical practice. Okay, this wrist joint looks too flexible or less than normal flexible. This is how you will identify whether how much is the tone in the muscle. Now we come to the next point, to test the strength of the muscle. Now this is very, very important, grading of muscle. If you remember this, This will be used not only in the current exam but also on the clinical side. Okay, you should know how to grade any muscle. Okay, so how do you grade? You will say there is grade 0, yani there is no movement. Whatever you ask him, he will not be able to do. You try to move, there will be no movement there. Okay, no contraction at all. So that will be grade 0. Grade 1, some tremor like movement will be there. You ask the patient to contract his bicep, there will be some tremor or flicker like movement in the bicep, nothing else, no hand movement. Okay, so that will be flicker. Grade 2, slightly more power. He is able to move hand, but he is not able to lift the hand against gravity. He can move the hand sideways. Okay, so when there is no gravity, it will be called as grade 2. Grade 3 is he can move against gravity. He can lift his hand. Okay, against gravity. So that is grade 3. Grade 4 is he is able to lift against gravity also, but also when you apply some resistance. So that will be grade 4. Grade 5 is normal. Now normal is different for different people. Just remember it theoretically. So normal strength of one person is different from normal strength of other person. Again, all these require clinical experience. But for now, from theory point of view, from our OSPE point of view, you need to know the grade of the grading the strength of the muscle. Okay, that you should know. Any difficulty till this part?
Clear, doctor.
No.
Okay. So the point I said here was remember the grading strengths. Okay, how the strengths are graded. Muscle strength is graded. So this is what I have asked you here. So you should know these 5 grades. Okay. So here we have grading for the muscles stretch reflexes also. Here we don't need to go into the details here. You just need to know some examples of stretch reflex. So the very famous one is knee jerk, ankle jerk, biceps and triceps. So these are very, very important example of stretch reflex. Then there is a reflex which is not related to stretch but clinically very, very important, plantar reflex. Okay, so these are the important ones you should remember. Okay.
Doctor, one question.
Yes, please.
Do we have to know the roots or just like the examples?
No. Again, the roots are only for anatomy. This topic was earlier taught by anatomy people. So they used to ask. I'm not interested in anatomy.
Okay, thank you, doctor. Thank you.
Okay. I just want you to know the concepts only. Okay, in this picture, do you see any abnormality? By your personal experience, look at your own hand and look at the hand in this picture. Anything abnormal you see here?
More contraction.
Contraction we cannot identify on picture. Next attempt. Very good try. Anything else you see?
Deformities.
Okay, you can say that the fingers look like deformity, but where my arrow is pointing, can you see my arrow?
Triangle box. Muscle atrophy.
Yes, very good. It is atrophy of muscle. You can see, you can compare your own hand and this hand. This depression is not there on the posterior side. You can see the depression here. This is not supposed to be there. These are all hypothenar and thenar muscles, isn't it? The names of the muscle. I also don't remember the names. But these muscles, they are very prominent normally in a normal person, isn't it? A small swelling sort of things is there here because of that muscle. When that muscle is lost, you can see the depression very clearly. Okay? So this is wasting of muscle atrophy. Please remember this. So what is this picture showing?
Wasting of muscle.
Wasting of muscle. Very good. And in which condition you get wasting of muscle? Upper motor neuron paralysis or lower motor neuron paralysis?
Lower.
In which condition you get?
Lower motor neuron.
Lower.
Very good. So now you are understanding the pattern here. I will show you a picture and I will ask you 2 questions. Okay? So this is the pattern we will be using in all exams, including our OSPE. Okay. So what is this picture showing you? First question is, what is this picture showing you?
Muscle atrophy.
Muscle atrophy, muscle wasting, whatever you want to write. Second question will be, why or in which condition you find? Lower motor neuron. Muscle atrophy you will find in lower motor neuron. Very good. Okay. What is the examination shown here? This is the way picture will be there. Okay. So you have to identify what type of examination it is showing here. Here, basically, the person, what he is doing is the examiner is trying to move the joints passively. He's asking the patient to relax the joint, then he's moving his hand to see how much resistance he get. Okay, so with experience you will know the resistance is more than normal or less than normal. So that is done for tone examination. Okay, so here is another example of tone examination. He is moving the leg passively. He asks the patient to relax the leg and he is moving it passively, so that hip joint relaxation he is testing. So that will again tell us about the tone of the muscles around the hip joint. Okay. Now we come to very important part of the clinical examination, that is eliciting reflexes. So here you can see the thumb is on one tendon and the doctor is striking the thumb with the hammer here. So which reflex is this?
Biceps jerk.
Biceps.
Okay, biceps jerk or biceps reflex. Very nice. Which reflex is here? You can see the tendon he is striking directly. Which reflex? Triceps reflex, isn't it? Very good. Here we have brachioradialis reflex also, but here is my favorite one. Okay, knee jerk. Can you see the knee jerk reflex here?
Yes.
Okay, so here normally, as I said, your left hand should be above the knee joint because these are the muscles which are going to contract, isn't it? This is the quadriceps muscles which are going to contract. So your left hand should be on this part, okay, on the quadriceps muscle, and then you strike the tendon. So even if the leg doesn't move, you will feel the contraction in the quadriceps muscle. That is the purpose here. So you should know this. So which instrument is used here?
Tendon hammer.
The hammer.
Tendon hammer. Very right. Okay, and the reflex elicited is knee jerk. Please remember this. Which reflex is elicited here
The ankle.
in this picture? Ankle reflex. Okay, you can see here the ankle tendon of the Achilles tendon, as this is tendon is called as, that is being struck and that causes movement here. You can see the other hand is holding the front part of the foot, isn't it? That is the right way. So when you strike the tendon, the foot will go down and he will feel the movement in the foot, even if you don't see it, if the movements are very small. Okay, so that is ankle reflex. Next one is very clinically very important reflex. I want you to remember everything about it. I told you this in our theory lecture also, and I'm telling you this now also. Plantar reflex is very important. So remember everything. So first of all, what is this picture showing? Which reflex is being elicited here?
Plantar reflex.
Plantar reflex, elicitation of plantar reflex. Okay. What is the normal response in plantar reflex? Now I'm going to ask you a series of questions. Okay. So please answer and remember them. What is the normal response in plantar reflex?
Flexion.
Flexion. Okay. Plantar flexion. So the proper answer is plantar flexion. Now, my next question is, what do you mean by Babinski's negative?
It's flexion, right?
Flexion.
यानी normal, isn't it?
Normal.
Babinski's sign negative यानी normal. Okay, very good. Now, my next question is, what is Babinski's sign positive?
Opposite.
Extension of the motor neuron.
Extension.
No. I'm telling in terms of reflexes. What is the meaning?
Extension of the...
Abnormal.
It is abnormal, okay, right? And it is, as just now somebody said,
Plantar
extension, isn't it?
Yeah.
Isn't it? Okay. My last question, in this picture, after eliciting the reflex, is it plantar flexion occurring or extension occurring?
Extension.
Extension. So is it positive? Babinski sign positive or negative?
Positive.
Positive. Is it normal or abnormal?
Abnormal.
Abnormal. Very good. So you have answered all the question. Please remember all the answers also. Any difficulty till this part?
It's okay. The root is not with us, right, doctor?
No. For physiology, it is not there. Maybe in anatomy. Okay?
Yes.
Don't worry about root. Okay? As a clinician, you should know the other details. Root is not important for physiology concepts. Any difficulty here?
Clear, doctor.
Okay. So just to summarize, here is a picture. You have to identify the picture. The picture is showing elicitation of plantar reflex. Okay. And then you should know what is plantar reflex, what is normal plantar reflex, what is abnormal plantar reflex. Normal is plantar flexion. Okay. Abnormal is extension of toes. Isn't it? Fanning and extension of toes. So you can see here the greater toe and the lesser toe all are extended. They are going back. They are not flexed in front, isn't it? So extension is there. Next thing you should know, the normal is called as Babinski negative and the abnormal is called as Babinski positive. These are the things you should remember about plantar reflex. Very good. Now we come to related to motor system, but very, very important structure, that is cerebellum. So for cerebellum, we have multiple, this cerebellum is primarily responsible for posture, balance and related fine tuning and all those things, isn't it? So we have a test for that, timing and everything. So the two very famous tests which we do is finger nose test and heel shin test. This is for upper limb. This is for lower limb. Okay. Are we clear?
Yes.
Okay. What are the
Yes,
other
doctor,
tests
yes.
used for? Sorry. Did you say something?
No, I'm sorry. I was just replying. Yes, doctor. Yes, we understand.
Good. So our first concept I tried to tell you just now was the test used to examine cerebellum function in upper limb. The number one test you will tell is finger nose test. I don't know what is written here. It is wrong. Finger to nose. Okay. This is wrong. It is simple finger nose test. Are we clear?
Yes.
Okay. Please remember this word, finger nose test. What is the second or alternate method for examining upper limb?
Rapid alternating movement.
Very good. So this is the second one you can say. So I have shown you this in our theory lecture, isn't it? Rapid alternating movement. And if the person is not able to do this, what we call it as?
Ataxia.
Ataxia is for lower limb. It is for learning mostly, inability to perform learned movement. But there is another one with D, word D, alphabet D.
Tremors.
D, dog. With alphabet D. It starts with alphabet D.
Dysdiadokinesia.
Right. Dysdiadochokinesia. But don't worry, nobody is going to ask you in OSPE part the terminology, because in OSPE mostly you have to write the words. There is no multiple choice. Okay. So what you will remember about cerebellum function is, for upper limb we use finger nose test. Can you remember these simple words, finger nose test?
Yes.
Okay, let me write it down. Test. Okay. I don't know how this is written, but this is the proper one. Okay. Second, for lower limb, you will remember is heel to shin test. I'll show you both of them later on. Here is our finger nose test. Can you remember this? This picture.
Yes.
Yes.
What is going on here? What is the doctor asking patient to do?
To put the finger on the nose.
His nose.
He is asking to touch the nose and then the finger. Okay, you can see the finger of the examiner here and the nose of the patient. He's asking the person to touch the nose, then touch the finger, touch the nose, touch the finger, like this. So multiple time they do this. So that way you know the function of cerebellum. Okay, clear? Any difficulty?
Clear, doctor.
Okay.
None, doctor. Thank you.
So the thing is, what you will remember is this picture shows finger nose test demonstration. Second thing will be which part of the central nervous system this picture is testing. Is this testing sensory system?
Cerebellum.
Right. It is testing cerebellum, not sensory system, not motor system, but cerebellum. Okay. Please remember this. This is the second alternate method. This is our heel to shin test, where the doctor asks the patient to touch his heel to the shin and rub it down. Okay. He asks the patient to touch the heel on the other leg shin and rub it down. Are we clear? So
Yes.
that way the heel goes down like this. Okay. So if the person's cerebellum is working normal, he'll be able to do it in straight line. This is the principle behind that. And again, this test is for cerebellum. Now we come to walking or gait. Okay. Posture during movement. That is called as gait. So if a person's cerebellum is normal, he'll be able to walk in straight line when he's asked to touch his foot one after another. When there is problem, he'll not be able to do. Again, this test is for cerebellum. Okay. Okay. So this is another test for cerebellum, which is called as Romberg test. Basically, we ask the person to close his eyes and see if he's able to stand straight. Okay. Don't worry about this. So we have finished some major important tests related to motor system, that is reflexes, and related to cerebellum. Okay. Any difficulty till this part? Picture of the plantar reflex. What we are doing, stimulating the receptor, superficial stimulation, isn't it? And that causes the toes to flex. Okay. So this is a stimulation of the receptors here, basically. Okay.
Doctor, plantar reflex is a sensory reflex, not a motor, right?
There is a motor response to it, but it is for testing the sensory system mainly. Okay. Stretch reflex is for motor system. All stretch reflexes. But plantar is for sensory. Okay. Corneal test, conjunctival test, abdominal test, and plantar test, these are all for sensory system. Please remember that. Okay, here are the some. Yes. Yes.
All what this written in this paper is just for knowledge, right?
This you have to identify which one is for exam. I cannot tell you which one is for exam, isn't it?
No, just for knowledge. I mean that it can be enumerated like an exam. That's what's up.
Yes, I am trying to tell you how it will be asked in exam. Every question, every station will have 2 questions in general. Okay. In general, there will be 2 questions. For example, let us take this. This is another important one in sensory system. Okay. So here the doctor is, what he is doing, what is this picture showing you? The doctor is testing, ask the patient to close his eyes and moving his joint here, the thumb joint. Okay. Whatever this joint is called as, he is moving. The patient's eyes are closed. Then he moves the thumb forward or backward and asks, where is your thumb now? He will say whether it is flexed or extended. That way he will be able to identify the position of the reflex, position of the joint. So this is for your joint position test. Are we clear? Any difficulty here?
Yes, doctor, clear.
Okay. So let me ask you a question here. What is this picture demonstrating? Which test this picture is demonstrating? Showing.
Joint position sense.
Okay. So the answer is very right. This picture is showing testing of joint position sense. Very right. You can write joint position sense simply also. My second question is, which part of the nervous system this picture is showing? Which part of the nervous system is being tested by this test? Is it sensory system? Is it motor system? Is it cerebellum?
Sensory.
Sensory.
Sensory. Very good. In the sensory system, which part it is testing?
Cognitive.
Is it testing anterolateral spinothalamic tract or dorsal column tract?
Dorsal.
Dorsal column tract. Very good. In dorsal column tract, which there are two bundles, fasciculus cuneatus, fasciculus gracialis. Which one it is testing?
The cognitive.
Cuneate. Why?
For the touch. And
Cuneate tracts are part of dorsal column tract, which carry information from the upper part of the body. Gracialis carries information from the lower part of the body, lower limbs. Okay?
Yeah.
Clear?
Yes.
Okay. So, as a rule, let me repeat this again. What is this picture showing?
Joint position sense.
Very good. Which part of the nervous system this tract is testing?
The dorsal column tract, cuneate tract, sensory.
Very good. Now, if you write cuneate tract, I have to give marks. If you write sensory system, I have to give marks. If you write dorsal column tract, I have to give marks. Anything you remember, you can write, but it should be one of these three, isn't it?
Okay.
Are we clear?
Yeah.
So remember this.
Okay.
So these are the only pictures I can see in the slide. So remember them. Let me see if we are missing anything. We have covered plantar, which was very important. We have covered joint position sense also. And we have covered finger noses also. Knee jerks. So these are the major reflexes we have covered. I think this is good enough. So this is all which is done in the sensory system and motor system examination. And this finishes our discussion here. If you have any question, you can ask.
Doctor, just one question.
Yes.
In the last slide, the one, the sensory examination.
Okay. This one?
Before it.
Okay, this one. Okay.
Yeah, here.
So in sensory system examination, we are testing the sensations. So these are some of the sensations which are tested. How do you test it? So for fine touch, what do? You use cotton and then touch at different parts of the hand or leg and ask the person whether he is feeling that or not. Okay. Position, I told you how it is done. It is shown in this picture. This is position testing. Okay. Vibration, how it is tested? You should answer that. How vibration is tested? Using tuning fork on joint.
Yeah.
Okay, so please remember that. That is the function of tuning fork you have learned wherever you have learned, isn't it? For pain sensation and temperature, we don't do this. Okay, for pain sensation, you need to prick with pin. So this is not done in our lab. In the hospital, it may be required occasionally. For temperature, we give warm and cold tubes and all those things. Okay.
Okay.
More commonly, what is done is stereognosis. What is stereognosis?
When you close your eyes and you know the structure, object.
Okay, asked to identify known objects. So the person is able to identify known objects by touch. So that is stereognosis. So these are some other aspects which are there, which in real life, which we have to do, but we have to do as a clinicians. But for our exam, focus on these whatever we have. I have repeated multiple times. Okay.
Okay.
So I have repeated this picture. I have
Doctor, I
repeated.
have a question.
Yes.
In degree of reflex, like zero, no movement. So how it come in the exam? Like you give me the number, I have to know. If
No. I'll not give you a number. I'll show you here. Okay. Here is the thing. During the examination of the person, motor examination of the person was able to move his hand against gravity but was not able to move against resistance. So what is the strength of this person? What is your answer?
3.
Great. He is able to move against gravity but unable to move against resistance.
Okay, 4. 3, 3, 4.
3. He is not able to do this one. He is able to do akhir,
Okay.
this one. So the answer is grade 3. Okay.
Okay.
So the
we have
purpose,
to know the.
what
So we
I am
ha-
telling you is purpose of this question, this exam is I want you to remember the grade, because as a doctor you will be doing this, even as an intern you will be doing this. Okay, he is having grade 2 power in upper limb, grade 3 power in lower limb, grade 4 power, like this you will be talking as a doctor. Okay, so you should
So
know what is
doctor,
grade 1, grade 2, grade 3. Okay,
in strength or just in reflex, we have to know.
this is strength. This grading is for strength, no, not for reflex.
Okay.
Okay, in reflex, what we normally say in hospitals is not all these details. Normally, we simply say he's having reflex, he's not having reflex, and he's having hyperreflexia. That is all. Okay, we don't use routinely. So I did not focus here.
So
Okay,
doctor,
ideally, you
okay.
should.
And the number 3, what we have to know about it? Page 3.
Page
I'm
3.
confused about it.
What is page 3? This
Yeah,
is page 3?
yes.
This one?
Yeah. Yes.
This is all observation. You will see abnormal movements. That is the most common one. And for me personally, in observation, there will be muscle loss. So I'm more interested in observation of muscle loss because we have a picture there for that. This is the picture. Okay, that is all. So what is this picture showing? And in which condition you see it? Right?
Okay. Thank
In
you so
picture,
much.
I cannot show you abnormal movement. That is my problem, isn't it? Therefore, it is difficult to ask. But this I can show you nicely.
Okay.
Very good.
Okay.
So this is all there in the OSPE exam. In general, expect up to 4 stations. Each station will have 2 questions. Okay. Any difficulty? Any question?
No, it's clear.